Hi guys, Dr. Shaun here. Hope everyone is doing well, staying safe and healthy. And this week is Root Canal Awareness Week, and it's within the month of May, which is also known as Save Your Tooth Month. Okay, and I always highly recommend to patients that they save their tooth if they possibly can. And an integral part of doing that is to have the patient undergo any kind of root canal procedure in order to save the tooth. Okay, so today I'm going to be talking about root canals a little bit with you guys. So just a couple statistics first. 15% of people in the US actually avoid root canals. It's known as probably the most feared dental procedure at the dental office. 15 million root canals are performed each year, and 41,000 root canals are performed every day. And one last statistic is 97% of root canals are successful, and 85% of root canals can last a lifetime. So one of the questions is, what exactly is a root canal? Well, root canal is a treatment on the tooth that is used to repair the tooth by removing any kind of deep decay or an infection that has involved the root or the canals of the tooth. So basically, during a root canal procedure, we're cleaning out the nerve and the pulp and removing everything and sealing it all up and filling it all up so the tooth basically is now disease-free and the patient can keep it in their mouth and so they don't have to extract their tooth. So root canal is really going to help the patient basically save their tooth. So why do people need root canals? People need root canals when a tooth's nerve tissue or pulp is damaged. When that happens, it breaks down and the bacteria that is formed can cause an infection or even an abscess. So sometimes patients may complain of a raised ball area near their gum tissue next to a tooth. That's usually called an abscess, and that's usually because the nerve could be infected. Now, this happens usually when a patient either has deep decay. Sometimes if a patient has had repeated dental procedures, like they started off with a small filling, and then a larger filling, and even larger filling, then all of a sudden the tooth becomes traumatized and the nerve becomes involved, and now the tooth needs a root canal. Other reasons the tooth may need a root canal is if there's very large silver fillings, sometimes that has fracture lines, a cracked tooth, a chipped tooth, or even trauma to the face. There's a lot of different reasons why patients may need to undergo a root canal procedure. Now, what are the steps and how long do root canals take? So first of all, root canals can take a range of time. Sometimes it can be as easy as 30 minutes, sometimes a couple hours, but even sometimes if the tooth is really, really infected, that they will actually have to come back multiple appointments. The first appointment to kind of get rid of all the diseased nerve and pulp and let the tooth calm down a little bit, and then another appointment to kind of get back in there and finish it up. Now the steps to do a root canal, obviously the first step is to numb the patient up and isolate the area, usually using a rubber dam to make sure there's no kind of moisture involvement. Okay. Now the second step is to drill an access hole in the tooth and then use some small files to kind of clean away the pulp and shape the canal space and get that space ready for some filling material, or in this case, gutta percha. Now the third step, after all the space is clean and the canals are shaped, we're going to fill that area with gutta percha and sealer, and this is going to help seal the canals so that they can basically get back into the canal space. So we want to make sure everything's nice and sealed because there's a chance that the root canal can become reinfected again. But obviously, the better that the root canal is done, the better job that the root canal is done, and the more sealed it is, the less likely it's going to become reinfected. So it's very important. And in this case, this is when I usually recommend root canals to be sent to a specialist. This is what they do. They go to extra schooling for it. There's no reason for me to go ahead and try to do something that I feel like they'll do a better job at. So I always refer to a specialist, unless it's like a front tooth which has a single canal and it's very easy. But yeah, I always like to refer to my specialist to go ahead and they can take care of it, and I can go ahead and do the crown after the root canal. The next step, the last step, would basically be to fill that access hole with some temporary cement, some tampons, some Cavit. Usually, I have a couple of endodontists, they usually use different things, but once that tooth is finally finished and the patient waits a couple weeks and they come back to me and I do the final restoration, which is usually some sort of crown. Yeah, so that's pretty much the steps of a root canal. So remember, this week is Root Canal Awareness Week. Get out there and spread the awareness, spread the education on the importance of saving teeth. It's very important. This is root canals are the most feared dental procedure. Patients are always, I don't know if it's because of in the movies or the TV shows, but it's always portrayed as something that's very painful. If it's done correctly, that it should be pretty much painless. So I want you guys to go out there, educate your patients, educate your family. It's an integral part of saving your tooth is to have root canals done. Okay? If you have any questions, let me know. Thanks, guys.